to do. So they will be sitting here. Come on, come. So what's your name?
Colleen.
Colleen. Colleen and Kali. Good. So we were talking about anxiety, right? So which is one of the most common. Do you see, this is the wrong way of, do you have a back pain?
Not usually.
Lower back?
Sometimes.
Okay. So I would ask you to get up slowly. Okay. So when you get up, always keep your head straight. Okay. And slowly, you have to put effort, not the back. Okay. So knee. Okay. So now, what you have to do is sit, your bum should come right at the end. Good. Your structure changed, posture changed, right? And there is less pressure that comes on the back when you're sitting down. Okay? Most of our bad postures happen because of the furnitures that we have in our house, which are way too comfortable for us to sit. Right? And then we try to get even in the more comfortable posture because our body is telling us to sit straight. Right? So when it's uneven, what the body is telling you is that the flow is not happening as what we want it to be. So please try to get in the right posture for me to function better. So then that pain starts to indicate you, because otherwise we're not listening to our body, are we?
We're busy on the computer.
Yes. So again, this posture is really good. One is you can even sit like this in meditation, and this will give you better results than when you're slouching. So if you slouch, show them again. So it's very uncomfortable to sit in this position and slouch. You may not feel that great if you kind of sit like this, and at the end of your lumbar spine is kind of elongated, but then you're trying to do that. Right? So that won't help you. You won't feel comfortable. So you will straight away move back into posture again. Okay, so this is your brain trying to tell you that now you need to get into the right posture again. Our brain is the main source of everything, as we know. Right? So if we think too much, we think that our body is separate from the brain. So if I have a pain in my hand, I could just do something for my hand and it will be better. But no, it doesn't work that way. The pain starts from your head. Okay? And the more we know, the more scientists are going into understanding all these things. They're able to see that the receptors, the pain receptors which are there, are coming from the cerebral area, which is this part. Okay? So if you are using a wrong pillow at night, or some people have a habit of sleeping like this, right? You kind of have to use a hand, even though you may have a pillow. So you'll have a pillow, you'll have a hand, and you'll still be sleeping on one side. So when you wake up, this part is almost overstretched. Right? So then, when you come back into position, you release certain hormones which are giving you pain. So, and then it affects this area, cervical, which a lot of common ailments are there around cervical. So you might have a lot of pain in this area and this area. But then this travels, because this goes all the way from here to this area. And then so when you have cervical issues, you will also have migraine kind of pain. You'll have very intense pain. Right? And you will say, oh, I think I've got migraine. And then you will take huge amount of painkillers to stop your migraine. But it could be just this. Okay? So what I will teach you is, so there is, yesterday we talked about 3, 6, and 9, the importance of the number 3, 6, and 9. Okay? So one lady, you tried and you thought, I didn't really get that much results. But the same count, so when the other lady tried, she straight away felt calmer. Okay, so that's what I mean, individualistic approach to this therapy. So when a child comes to me, I wouldn't just try 369. You have to understand where the damage is. So when you study, so you just hold, this is the area where we have the solar plex, right? This area of the chakras, if that's what we understand as. But this is where, do you want to, yeah, come this side so it might be easier for all of you. So this is where the heat is produced. Right? This is where your ID, your ego, if you talk about psychological way, this is where it is stored. Okay? Lower part is where the insecurity is, where we call Muladhara chakra. Okay? And this is the part where we have love, creativity, everything that makes us move or want to live further and have a purpose. Okay? So what we do is we hold it this way, and this hand has to be here, just about. So I can feel the heat here for her. Is this painful sometimes? Right?
For many years.
So try and, okay, so let's start with a small exercise, how we can understand heat in the body. So get your hands a little closer. Okay, slowly, be conscious. Okay, so some might feel a little magnetic, kind of like it's as if it's trying to pull you apart from there, right? It's like positive and negative, right? So when you try to bring the hand near, you will feel like there's a force which is trying to push it away. How many of them feel it? Right? So we all do. That's amazing. Great. Do you feel it? Okay. So start concentrating between your hands. Okay? Don't look at me. Don't close your eyes. This is not about closing eyes. It's just feeling. Concentrate between the palms, not the fingers. Can you feel? The more you get aware about it, the more stronger you feel about this magnetic field, right? So when you feel that, do you feel it now? Yeah? Do you feel it? Slightly, good. So now we have started recognizing these areas, okay? Do you feel it? Do you feel everybody? Yeah? So when I'm trying to touch her body and here, both, there's a huge amount of issues that is concerned with her stomach. Okay?
That's been true.
Yeah? And then also her cervical. So her spine is a little weaker on the top part. Right? And there's a lot of stress.
Yes,
Okay? And I don't know her, trust me. I just met her yesterday. And we didn't have a talk, did we?
No.
Yeah, I was just talking. Right. So when I understand this about my patient, I didn't need to speak to her. I just had to understand and recognize her magnetic field. We all have a magnetic field. Okay? And you can heal yourself by knowing how I can do that. You don't need a therapist.
So this, in the week that I've done yoga every day
Yeah.
here, she has us do the shoulder rolls.
Right.
And after doing it for a week, this area feels much better. So am
Yes.
I influencing the energy that is there by
Yes, you're
doing-
freeing that area. Right? So when a lot of energy is concentrated in one area, because when you think too much, what you're doing is you are using all the energy which is in the body, you bringing it up to your head. Right? So if we do the chakra and energy field, we always say, oh, the energy rises from the Muladhara and it comes up. Right? So same thing goes for everything. It can't be just one thing. It will have to be everything, right? Except for the gravity. That's a different story, right? But in the space, it's not there. So again, to understand the energy, you need to know that it comes up. Even the air, when it is hot, it comes up, right? So our body is mainly heat for it to function better. So for the cells to be rejuvenated, you need to have heat in your body. If your body is getting colder, when the body is dead, what happens? Have you ever touched a dead body? So what is it? Is it hot or cold? Right? That means the energy has dispersed.
And it's a different kind of cold.
Yes. But yes, you moving as you age, your body tend to get colder and colder. So that's where we say that you have to get into regular meditational therapies, or you need to get your energy higher and have more hot food or more water which is lukewarm rather than going towards cold water. But if you give the same thing to a youth, a young guy, they will probably crunch on ice and nothing will happen. And the same thing if I give it to an older person, it will have a different effect on their digestive system. Okay? So always have a little like room temperature. I wouldn't even go say hot water. I would say try and get it to the room temperature. Always drink a room temperature water, not too cold, not too hot. Right? Because the body will convert the water, even if it is ice cold, it will still convert it into the temperature of the body. But if we give that much amount, the same temperature that the body is, the body doesn't have to work harder on doing that. Okay? So, let's get back to Kali. Colleen, okay. So today I'm going to call her Kali because it's the 7th day of Navratri.
That's quite all right.
Right. So this area, it means her metabolism is very slow. So what can we do to increase the metabolism? That's for her, right? So when we have this area, this part, okay, so put your hand there. Okay, so first we energized, we did this. Okay, so we created like an energy ball. Right? So what we're doing is we're taking this and we're putting it here. So you'll feel like a rib. Right? So you have the end of the rib. Okay, so this is the point of increasing the metabolism. Okay, so what you have to do is you have to press 1, 2, and 3. And then release, and then take a deep breath. How many people are breathing in and the stomach comes out? Good. Good. Try breathing again and see if the stomach comes out. Because I know a lot of people who breathe in and take the stomach in. Yeah, so you're not breathing from lungs. You make sure you're breathing from your stomach because the diaphragm is here, right? It's not in the lungs. So the breathing starts from the diaphragm here. Anybody who is from the science field knows that, right? So breathe from the stomach. So can you take a deep breath? Good. So it should expand like a balloon and then it goes back. Good. So because she's elongated her body, it's very easy to fill in the air in the stomach. But if I ask her to slouch, can you slouch? Yeah. Can you try and breathe in now? No. It's harder.
And with my patients these days,
Yeah.
who all slouch,
Yeah.
it's especially difficult to teach some of them to breathe.
Breathe
in
out,
that
right?
way.
So this would be the best way to make them sit.
Sit up.
Yeah. Some of them may have a slouch from the middle back, right? So give them a pillow, but keep them straight with support. So that will help them to breathe. And that's automatic mechanism. Okay? So now, we did 3. So, can we go into doing the 6th? Okay? So, breathe out. And breathe in. So we're going to push. And then breathe in. And breathe out. Breathe in. And breathe out. Breathe in. Breathe out. Breathe in. Breathe out. And let's make this the last one of the 6. And breathe out. And let it loose. Okay? So this you can do. So we still have 9 to go. So we did 3, 6. Yeah? We got 1 more to go, which is 9. Ask the patient, whoever is not able to digest food properly, ask them to do this before every meal. Right? So that will help in starting the fire in the belly. Right? So whenever you eat something, especially when you're in India, we eat a lot of wheat. Right? Compared to, because I know in London you hardly eat any gluten. So it's very hard to come to India and be able to digest our food because it's heavy in salts, sugars, oils, and we're all fit. So it's because over here there is more heat as well. So there is a natural source of heat which helps them to digest. But if somebody who's coming from abroad may not be able to do that straight away because their vitamin D is not at a good level. Right? So again, now we're going to start with the 9 count. Okay? So again, we start with a pressing point. Okay? Is everybody able to understand? Is it okay? Everything? The end of the rib. Yeah. Right? So, again. 1. Okay. So what are you doing? Do you want to come here? I show you something which is the wrong way of doing something. Sorry, I'm not picking on you, but I want you to get it right. Right? So, take it press it first. Can you feel your rib? Yeah. So, press it first and take a deep breath. Take more. Deep breath. Yes. Go out more. Out, out. See, here, when I press, I'm taking in. Okay? And then, this should literally push out. So when you're breathing out, so it should be, yeah? So you will feel it. Right now you may not be feeling that energy because what you're doing is you're not expanding it all the way. Okay? So the trick is taking breath in and also breathing out. Okay? If your breath is not fluid or it's not free, you may not feel as much of the energy rising in your stomach. Okay, so again, we'll start. We did 1. Yeah, we'll do the second one. So we press with start again. Good. Good. Anyone counting? 7, okay. This is the 8th, yeah? 8. And 9. Okay. Is anybody sweaty by now? Yeah?
The whole time.
Whole time, right? So this is what I'm saying, that we have produced heat in our body. So anybody who's living in a colder region can, when they start doing this before a meal, it helps them to digest food very well. There's another secret of breathing. Okay? So we're going to use the right nostrils. Remember I told you about using different nostrils to activate certain areas of the brain. But we can also activate the second brain, which is our guts. Right? So we're going to take the count of 27. But we're going to breathe from the right nostrils. Okay, and close this one. So we're not going to use left at all. All we're going to do is just breathe in and breathe out from the right nostrils. Okay? So, use the other hand. Yeah, this is, we're not doing the other one. No. Yes, right. Okay, good. Please know your right from the left. I'll have to otherwise give an extra lesson. Yeah. So I'll have to activate another brain part then. Good. So keep doing until it's 27. Deep breath, not shallow breath, okay? You can do this with children as well by just shutting that one left side, and you just keep one, and they will automatically breathe from only one side. Who's counting? Good. I'm just seeing the technique of everyone. I can't see anybody's stomach coming out. Please, when you're breathing in, the stomach should come out. Good. Where are we at? 20, good. So 7 to go. 27. So if anybody gets really hungry during this session, we'll have to ask Nandiji to provide a hefty meal after all of this. Good. And then just take in a normal breath. What do you feel? The other one raised the temperature. You felt sweaty, right? Right. So this is relaxing your abdomen because we carry a lot of stress. Okay? A lot of weight gain is always because of the stress hormones, which creates other diseases. Right? So this helps. One, we are increasing the heat. Okay? The first part is increasing the heat. Second is relaxing the body, which both are needed, right? If your muscles are not relaxed and you raise the heat, but you're not able to work that system, it does not help. So the more relaxed our digestive system is, the better the digestion. Helps whoever is having constipation. Those are one of the reasons, because of the stressful lifestyle that they have. The problem with a lot of healers, a lot of practitioners who are working with people who have some form of issues, disease, we are empathetic towards them, but at the same time, we start putting ourselves in their place. And it's a very common mistake. We link themselves with us, but that's not how it should happen. I'm not saying not to think about them. I'm saying that when you're a healer, you have to detach from that and think that they are dependent on you to get a better health. Okay? So if you come at the same energy level as them, you cannot heal them. Then you become the same. Right? I know a lot of caretakers who are taking care of their loved ones. A lot of times they will inherit the same disease that of the caretaker. Right? Because they get emotionally attached to that situation. So if you ask any caretaker, they will always talk about how much effort they put into taking care of that person. So when you ask them about any topic, you could talk about anything in the world. You could be talking about a very good-looking actor, and they will all bring it down again to the same place.
It's draining. It's draining when you do that.
Yes.
Your own energy.
But that's the reason why we become obsessed about it. That I am the one who's taking care. I am the one who's doing this, but you don't take care of yourself. Because you're constantly going to their level. Right? They're coming for help to you. They're coming to heal to you. So you should have a higher energy to give. Right? You should not put yourself in that level to say, being an empath doesn't mean that you don't recognize that they need help. Being an empath means you taking care of the situation that needs attention. Right? So if I am giving therapy or understanding the magnetic field around her, I don't need to get attached to her. All I'm saying to her is, please tell me where your problem is. And the energy starts communicating with you where the issue is. But if you get attached, they will never talk to you. They will pull you in. So you will never know what the issue is. You will be working really hard with them. You'll be like, oh, I'm working so hard, but I can't see improvement. It's because you are getting soaked in and you don't exist anymore. Physically you are, but your energy is soaked in because you're at the same level. Right? So any healer out here, you have to detach.
This couldn't be more perfect for me.
We all do. Whoever is sitting in this room may be in some way or the other looking after somebody. And that's why you're here. Because you find yourself low in energy, so what you're doing is you're traveling, you're going to places where you feel where the energy source is higher, so you can collect that energy. But then as soon as you go near that patient or the person, you feel drained out again. Because I get complaint from mothers, a lot of times that I feel exhausted when I'm looking after my child. Because mother is obviously very attached to the child, but she forgets that when she's doing the therapy, she is the therapist. She's the doctor of the child. So she is not just the mother, that she does not have to be attached when giving the therapy. Okay? So always realize you are the healer. You are not supposed to get too drained into them. And if you're consciously aware of this, you will automatically find that even if you see 10 different patients, because a lot of people ask me, you work with patients who have so much emotional disturbance in them, mental health illness, especially when we see autistic kids or development delays or cerebral palsy, which can be quite, it does take a lot of drilling when you are with those patients. So a lot of people ask me why you don't get drained out. In fact, when I'm with the patient, I feel much better after I'm out. Right? So the reason is that when I go in there, I'm not thinking that I'm the one who's doing everything. Right? A lot of people say, oh, I am the one who's taking care. I am the one. But there is a source out there who's above you, whether we like it or not. A source of infinite energy who's going to give you that strength when you're working with someone who needs your energy. So you always have to remember that energy is infinite. You don't have to go somewhere to get that energy. The energy is coming. It's always there. You could be sitting in the most, I think there would be dustbins around, everything around. And people think, oh, my energy is going to get really bad if I'm here. No, India is not one of the most cleanest country. But the most spiritual experiences that people are getting are from India. Right? So energy level in this part of the earth is much more higher, because I can say that because of the sun. If you go to Bali, if you go to any country which has higher sun temperatures, you will find the energy is higher in that area. Okay? So the water sources are higher in the same countries. If you go to Caribbean, you go to all these places, you will find women and men with very strong energies. Right? And you might feel, oh, this is very overpowering. Kind of when you come in front of a woman who has all the strength, you might find it very overpowering to talk to that woman. But it's natural for them. Because they're brought up with that feeling of being connected to earth. Their lifestyle is very much connected to the earth. Some of them do their own farming. Some of them are always, playing with the mud. They're making something, handicraft. So you will find them never getting sick. You go to the tribal areas of India, they hardly get sick. You won't find hospitals there because the rate of women who are getting sick is much lesser than the city women. If you go to the Himalayas, you go to Himachal Pradesh and the villages above, they know each and every plant, what is the medicinal use of that. So if they find themselves, going down with illness, they know which plant is going to help them. They can't just wake up and know that, right? It must be their grandma who must have taken her to the farm, asked her to sow the seeds, and then made her understand why we're planting that seed there. So this goes into cultural inheritance of children who are working with the land, with the earth. It's only city people like us who need help. Right? But I'm not saying that they don't need we have to ignore them. But yes, majority of the time they live a healthy life. Okay? Because they know these things. They know about the energy. They know about the power of the earth. And Parmat does a lot of work in that area as well. So I think they have also understood the power of what it is to be connected to Mother Earth. And that's why so many people are pulled to this area. Right? So, should we move to the second part? Okay.
I just want to remember this. So, with anxiety and indigestion.
This was indigestion thing. This was about weaker. Not the 369. That's for the anxiety. That's for when you're feeling too stressed out. Your heartbeat, like somebody's, if their BP has gone really high. Blood pressure, okay? You can use this.
Okay. 369.
Yes, 369. You can start giving them straight away. You will find that their BP gets controlled slowly.
And will the left nostril or the right nostril help that as well?
No, just 369. You just have to stimulate it and then ask them to breathe deeper breath from the stomach. Okay, so that's for blood pressure if it has high blood pressure, okay, and stress. That's for indigestion, stomach problems, increasing the metabolism. This point is for increasing the metabolism. So increasing the Jathar Agni, which is the digestion fire. That's what we call it, right? So the breath one, the one that you do that, it's for helping to loosen up the muscles here so that you are able to. So one is to take the food and then make the juices faster so the nutrition go to the right place. And the other one is to pass on what needs to go into the bigger intestine and then the smaller intestine because it's looser. If there is a space, right, then things go faster, right? It will go faster. But if it is tightened, it won't. It will be harder. So what people do is in Ayurveda, they say half an hour before meal and half an hour after meal, you're not supposed to have water. But a lot of us, what we do is we drink water when we eat it because we're not able to digest that. We're not able to take it in. So when we do this exercise of 27 times, what we're doing is we're relieving all the muscles from here to here, and you won't need water to take that food in.
You do this first and then the left.
Yes. Yeah.
Right now.
Yes. Right, not the left.
Right.
Yes? And don't do like pranayam. So a lot of people were doing this, right? No. You can just use this hand, whatever is easy for you.
Is it better to do before you eat?
Yes, yes. You have to do this before you eat.
Or
No, 5 minutes.
5 minutes? Okay.
Yeah, because this will take 5 minutes. So you can do straight away, you can do this. You don't have to wait. Our systems don't have to wait for us to eat food. But because of our weaker systems now, we have to do all those things. Right? So we live in an age where we are sitting maximum. We're not doing activities as much. So that's why we need to do these exercises. Okay? So we're going to go. Okay, how many times do you bite your food when you take one?
Not enough.
How many times? Any answer? Huh?
We never know, but it depends, you know.
When you're very hungry, it just goes down.
Right.
You're supposed to. How many teeth are there? So you have to bite it 32 times.
Each bite.
Yes.
Who has time to do that?
If you do that, you will find that you are getting less hungry and you will eat more consciously whatever food you're eating. What we do is most of the time I feel that we are on the phone, we're either talking to somebody, right? Or we're watching TV. Right? So what happens is we're not conscious of when we're eating our food. I know someone who lost weight around 20 kgs just by biting food 32 times. So you don't have to run, you don't have to walk 10,000 steps a day. All you need to do is bite your food 32 times. Right? So it's all about how we take our food. And the food is the base of, if it's right nutrition, we live a healthy life. If it is bad, but even if it is a good food, but we are not able to digest, it becomes poison. So a lot of people who come to me say, oh, how come I'm eating such healthy food, or I feed my child a lot of healthy food, but they still have this illness? I say because his digestion system is really weak, whatever you give, it still turns into poisonous gas. And that gas is inflation. And what it turns into is inflammation. Right? Because it expands. So when there are certain body organs which expands, then the other ones become smaller. And that inflammation in the body turns into disease. Diabetes is one of the most common one. right? Cancer is one of the most common ones. Okay, so that's why in Ayurveda or any other healing, the first thing they ask you is, how is your digestive system? Right? But if there is a child who comes to you for healing, you know that their digestive system is not good. How would you ask a child to do it? Or how would you ask a 6-month-old baby to do it? So what I explained is the mother can, so here, right, this point above and this point just 2 fingers below the navel. So somebody might have a higher navel, somebody might have a lower navel. We all have a different position of navels, right? So just 2 fingers and then this point. Some might feel a little pain when you touch it. If you have indigestion issues, you might feel a little pain, okay? But if you don't, it's fine. You just have to press that. So we're talking about children. You can do it with adults as well who are not able to move or they can't do it. You just have to press for 3 seconds and then release. 3 and release. So that you have to do around 12 times. For one area. Yeah, be gentle because that might be tender for a lot of patients who have constipation issues. So if you press harder, that will initiate pain, which they won't associate in a good way, right? So slowly, always be sensitive. So when you find it's painful, it's because you might find a little tightness around this area of the patient. You might, even for some children, I have noticed, it's really hard. It almost feels like there's a cord there. It's that hard. These are the kids who have constipation for like almost 2 months, 3 months, and they have to be forced, right? So that's where it is harder, okay? Then you go above, and then again what we did, right? So with the child, mother can do that, right? So press it for longer. They will have to press it for longer until the child can't breathe, and then she has to relieve that so that the child will breathe out completely. So we have to manipulate their breathing system a bit by pressing this harder and then releasing it when they want to breathe out really bad. And then you kind of, okay? With this 27 times that we did with the right one, we have to just, with the child as well, you can do the same. Just close one. And the child will breathe in and out through just one nostril. Okay? So that's how we kind of initiating them into doing this, because they don't know how to do it. You won't be able to tell them, oh, do that. Okay? So this is, I found, one of the most common issues with today's people is digestion. So that's why I went into this topic. Okay? Now, another common, what do you think is the most common one? Neck pain? Back pain? Cervical. Cervical is one of the most biggest issues today because of our desk work, right? And phones, of course, because those are the only friends we have at the moment, right? I know people who have 3,000 friends on Instagram or whatever, but when you see them in public, you find them very lonely. Because they never learn how to connect to a human being. Because it's easy to show an image of yourself as one of the most popular individual. But in the crowd, they don't know how to communicate. That does not help. Right? Okay. So, the cervical part. This part, normally cervical is attached to emotional attachment. Right? So this is where we store our emotions. Okay? So some may find it very painful. Do you want to sit on this side because it would be easier for you to?
Is that below the collarbone?
Just here. Here.
Right
Where
below
just
the
near
calf.
the, yeah, just near your bra straps. Yeah? Yeah? You feel the pain?
Oh, I sit like this a lot too.
Yeah.
To try to
So
relieve
this
that.
part.
Ow.
Yeah.
Yeah.
You should get that. You should get that ow. Okay? So when you get that, what you do is you press and release. Okay? Press and
So
release.
you can do it by yourself.
Yes. Everything that I'm teaching you, you can do yourself. Okay? This way. This is also the best way of putting more kind of pressure. If you find that you can't do it this way, you can do it this way. Because some might have pain on the cervical area, so they may not be able to do that. But you can always take the support of your chest and press that point. It might be easier. You hold it for about 3 seconds. The rule is 3, 6, or 9. Okay? So, when you keep doing that, there will be a release in this area. Okay? When that release happens, okay, straight away, this will open up. Okay? When this opens up, this becomes aligned much better. Right? Then, the next point is, can you see it? Can you turn around a little bit? So, yeah, perfect. So, this is the occipital, right? Yep. So this, you might find a little hollow space in there. Do you? Okay, perfect. So what you do is you take the thumb on yourself, you can do this, right? And then you push up. Does it pain?
No, feels good.
Good. So some may find it painful. Okay. And then you release after 3 seconds. Okay, again. And release. It's like a pocket. You'll find like a pocket thing. And
You're kind of going up.
yes. So you press it upwards, not the side. You press it upwards. Again. This is also very good for children who are not able to hold their heads. You know, you find cerebral palsy children who have floppy muscles. So their head is always kind of coming down or not able to balance them, right? So this point is very good. Second, what you can do is you take these two and you kind of go. Okay? Yeah, so when you're doing it to yourself, you can just go, right? With higher pressure. So you have to, if somebody else is doing, I'm putting my pressure in there, right? So it's easier. But when you do it to yourself, you'll have to put a little bit more effort to it. Yes. Okay? So that's for the neck on this area. Now, we're going to take the shoulders. You can stay here. So, when I take the shoulder, what I have to do is I have to lift this area and this area. So, I'll take it up and loosen it. So, what did I do? I'll show you from one side. I take it up. Can you see this point? So, I'm taking one point. I'm putting it firm. And then I'm taking it up. Okay? And the same thing on this side. So,
Just at the edge
yes.
of the scapula.
Yeah. And then you release that. That's instant relief to your shoulders. We sometimes do that, right? When we're trying to you meet a friend and who looks very stressful, we just unknowingly do that, right? So it's your body who's telling you, where to kind of put your hand. A lot of times when we are anxious, you might find somebody putting their hand on their stomach because that's where they store. So they are putting their hand there to heal themselves. So it's a natural body kind of telling you what to do. Okay? So these two, and then if some people might have a little bump here. Right? So what you do is you press this and you pull it down. So you take the top, wherever the bump is that it starts, and then you press it down. Yes, downside. Okay? Because what's happening is when you're putting it down, this spine has come up, this area. So between the vertebrae, there's more space, wider space. And when you put it up, there is a danger of a nerve pinch. So some people might find numbness in their hands is because one of the nerve is pinched between the vertebrae. So they might feel, oh, I think I have a problem, I have a bigger problem. But it might be cervical.
Do it 3 times?
Yes. So you do it again. So it's 1, 2, 3. 1, 2, 3. And then you do this again. 1, 2, and 3. And then you can do the 3, 6, 9 thing. I'll have to end this session because I think we have the next Bhagavati ji is coming. I thought I was told to. I can continue if I want. You let me know. I could be here 4 hours if you're ready to sit.
We can see that. You have so much knowledge.
But these are all practical things, right? That you can do it to yourself. So you don't need somebody else to help you out, but if you need to give it to someone, you can. So these are the places where you store all your negative energy. This part. So that's why they say if you have a husband who comes home and you want the shopping money, apart from what you earn, you'll be like, honey, let me just give you a little massage. And then you'll see that wallet coming out. So this is also a money magnet. I know all us women who are sitting here, they're very independent, but I would always love some extra cash and a gift. That never hurts. I always get happier. But yes, so this is where we release a lot of energy of ours by just doing simple things. Okay? But very effective. If your stomach is good, you will never get cervical. This is one brain. Miraculous brain. This is another one. A lot of diseases, autoimmune diseases, all of those digestive diseases, they are all because of the weaker system of our stomach. We'll do another session soon. Yes? I hope you guys had fun and do these things more often and see how it feels, because these simple techniques will help you to live a balanced kind of lifestyle and not thinking about what I should be eating. Don't put negative ideas about food, because a lot of people say, oh, I should not eat gluten. I should not eat milk. What have they done to you? Nothing. But it's your own belief about this system. We have always emotionally abused ourselves, especially females. I'm sorry guys, nothing against you. But females are always made to feel guilty about eating or enjoying their food. Right? You will see a man boast about his appetite. He'll say, I have 10 rotis in a day and nothing happens. Imagine a female saying, I have a 10 roti. The guy will look at him, oh, you will get fat. Right. So that is an emotional abuse that we do, and whenever you're eating that food, you attaching that and then you bringing it into your body, which converts again into what you don't want.
It starts early.
Yeah. And it's very early in childhood that the mother says, don't eat food, you'll get fat. But then with the son, they'll say, oh, you have to be physically fit, even though they don't give birth. Right? But females need to be fed properly. They should have more awareness of the nutritions, and they need to eat better meals. Okay? And this exercise will help them to do that. Okay? Thank you. Thank you for my dear Kali for today, because it's the 7th day. And may Navratri energy that you're in a very beautiful time of the year. It's Navratri where the energies are really high. It's a feminine energy. So feminine energy will always give you growth. Right? So we always, what do? We create. Females are creators. So this is the time for, especially today. Today is Kali. So Kali is always the one who fights with what's negative, and it brings what's positive. She even fought with her own husband, Shiva, to bring the change. So we have that power, and we need to do that with our own body first to start with. So don't go fighting with your husbands today, please. So yes, too much power. Yes, thank you. Okay.